All right. So welcome back, everyone. I'm here with Katie Hampson. So she earned a PhD in 2007 at Princeton University, where she developed contact tracing in the context of rabies. So she wanted to decipher the transmission of rabies in Tanzania, and she's now in Glasgow, where she's still working in infectious diseases, especially rabies in Tanzania, and she leads field research in Tanzania. And oops, sorry, my iPad died. And she's focused on the ecology of infectious diseases, mostly rabies, which is what she's going to talk to us about today. So if you've never joined us, you can post all your questions in the chat while she's talking, and she will answer them at the end of the talk. So thank you for joining us. Thank you, Katie, and over to you. Thanks.
Thank you. I hope you can hear me okay. It's very nice of you guys to join on a Sunday evening. I'm going to tell you a little bit about what I've been doing together with a large team in Tanzania for almost 2 decades now, and some of the lessons that I think we've learned about rabies from doing contact tracing. So the structure of my talk is basically going to begin with explaining what contact tracing is and how we've applied it to rabies. And then I'm going to run through lessons that we learn in relation to the risk of rabies, the number of people who die from the disease, what we've learned in terms of rabies surveillance, the transmission dynamics, control of rabies, and a short conclusion. So before I get going, you need a little bit of information really about what rabies is. So it's a disease that is 100% fatal. Depending on where you live in the world, you might not hear very much about people dying from it. But in the poorest countries of the world, around 1 person dies every 10 minutes from rabies transmitted by domestic dogs. And the tragedy of it is that rabies is really preventable in two main ways. The first of which is actually through eliminating the virus in the reservoir host, the domestic dog, through vaccination. And secondly, by delivering post-exposure prophylaxis to prevent the onset of fatal disease by vaccinating people immediately after they've been exposed to a rabid dog, typically. So those are the 2 main approaches. Now, you probably presumably have been following COVID and maybe somewhat familiar with contact tracing. This is sort of paraphrased what the WHO describes as the 3 components of contact tracing, where you identify people who have been potentially exposed to an infected individual, and then you reach out to them and inform them of actions they might need to take, which in the case of COVID will typically involve quarantine and isolation, and follow up to see if those individuals develop symptoms of disease, and whether, then again, the process continues. So how can you do that for dogs, given that rabies is basically transmitted by dogs? Well, rabies, the signs of rabies are really easily recognizable. This is a rabid dog. It's already you can see kind of a few classic signs of the disease. And what typically happens, the sort of process of transmission, is that an animal is bitten. The virus spreads through the nervous system until it reaches the brain, but that can take some time. That can take anything between a week up to a year, but typically around a month. And then once the virus starts replicating in the brain, the dog will start to behave strangely, and the virus will be shed in the saliva, and that's when it's infectious and it will go on and bite and infect others. And the infectious period is typically very short, just a couple of days or so, up to a maximum of 10 days. So because these signs of rabies, biting by a rabid dog, rapid death, they're really recognizable. People know if their dog typically has developed rabies and died or disappeared, and they will recall being bitten by a rabid dog. So what we did was started off with hospital records that look something like this, and then we would go to their village and try and find the person who has been bitten and try and really understand through interview whether the animal was rabid or not, if we can actually identify the owner, interview the owner about what happened, and ideally track the animal down until we can take a sample. This was all really made possible by Mzee Magoto here, who you can see. And he was a livestock field officer for about 20 years before he got seconded to me at the start of my PhD. And he, as well as being kind of essentially my primary contact tracer for 10 years, he essentially was like an adoptive father for me in Tanzania. He was my translator, he taught me Swahili, and we did everything together for quite some time. And the really good thing about it was that he'd worked in the region for the last 20 years. He knew everywhere, and he was very well known pretty much wherever he went. And he had a really good understanding of the kind of livestock diseases that are circulating and how to treat them. So it also meant that whenever we were visiting people to try and find out about rabies and give advice about rabies, he was also able to deal with some of their livestock issues, which was a really important part of building the trust needed to be able to do this kind of work. So here's a couple of examples of what contact tracing data would look like. I'm going to illustrate to you one of these. This is the cases shown in red. So the large red dot is the primary rabies case, the dog that we traced. This dog belonged to Mome, and we followed this dog, or we followed where it went to, and you can see from the map that it bit about 7 other dogs during the 2 days that it was infectious, and it covered quite a lot of ground. And you might wonder how we were able to know that this same dog was causing all these problems. During the course of the 2 days that this dog was infectious, this dog actually bit 21 children. So whilst we followed it and we took all the information about who it bit and where it went, the villagers themselves had actually done contact tracing for us, and so we were recovering the pattern of transmission and where it went. And not all dogs are this recognizable, but you can see a few examples from the map here of a number of dogs that bit typically locally within a short distance of their household, but you'll also see like a few long distance events. So there is this case in green here where the dog had been tied up at its own household with an ox chain, but it had turned up the next day in a village, 2 villages over, and had been biting children and dogs in this neighborhood, and was really recognizable because it still had this ox chain that it was dragging along all the time. So we've been doing that for quite some time. This slide basically captures what feels like my entire career of research. And these red dots represent the rabid dogs that we've identified in Serengeti district in northern Tanzania since around 2002. And you can see there's been 2 quite major outbreaks during that time. In addition to the animals that we've identified that were rabid, we've also seen over 9,000 animals that were bitten by those animals, and almost just over 2,000 people who have been exposed by these rabid animals, as well as 49 human rabies deaths over this period. Okay. So what have we actually learned scientifically and from a public health perspective? So contact tracing allows us to actually understand what happens when someone is bitten by a rabid dog, what steps they take to seek care, what care they receive, and whether they survive or not. So roughly, that plot that I showed you before of the rabies cases through time, that roughly corresponds to an average of between 20 and 80 persons being bitten by rabid dogs per 100,000 per year. And if we kind of translate up the deaths that we observed, then again, we're seeing around 1 to 2 deaths per 100,000 persons, but that varies between 1 to 5, depending on if it's an outbreak year or if it's low incidence. So in a country like Tanzania, what we therefore expect to see is between 300 and 3,000 deaths per year, if you scale up from the numbers that we see in Serengeti district. And if you're a doctor or a nurse and you're working at a district hospital and you're seeing patients, and you're seeing bite patients, about half of those that present to your hospital with bites are actually bites by rabid animals rather than healthy dogs, which is actually a very high proportion. It means that if you're, certainly in this part of Tanzania, the patients you see are really at risk of rabies. What we find, though, is from contact tracing that not everyone does get vaccinated and not everyone presents to a clinic. Around a quarter of people who are bitten by rabid dogs don't actually receive a vaccine. And there's many reasons for that. It can be they don't receive the vaccine because it's too expensive. Roughly the cost of post-exposure vaccination is on the order of $20 per vial. So for a course of 3 vaccinations, so 3 vials of vaccine, someone will be paying on around $60, plus the transport and the basic fees for hospital care and so on. So those costs really can mount up very rapidly and are sometimes unaffordable to people who live in this area where the kind of daily cost of living is less than $1.50 a day. So you can see Bokeh here on the left-hand side. She was bitten and it took her 2 weeks to be able to get treatment because her parents had actually had to sell a goat to be able to raise the funds to be able to pay for vaccination. The family that you see in the middle here, they were presented with an incredible dilemma because 6 of their children had been bitten by their puppy that developed rabies, and we tested and confirmed that the dog was rabid. And they were having to decide who in their family would not be able to receive the vaccine because they were having to raise funds for everyone. And then this next picture with a large number of people sitting outside a clinic, they're waiting for the district medical officer to return from Dar es Salaam, which is more than 48 hours travel away. And he's bringing back vaccines to be able to treat these people. So rabies vaccines are expensive, they're often in short supply, and it is also it's often the case that someone might have to travel to multiple clinics to be able to get vaccination. And in some cases, they might give up, especially if the wound is healed and they think, okay, well, things are probably okay. And it turns out that roughly 1 in 5 people bitten by a rabid dog in the absence of vaccination go on to develop disease. So it also means that those other 4 that didn't develop disease, which is obviously a good thing, but it can contribute to misunderstanding. Sometimes people can actually believe, okay, rabies is not as dangerous as it might seem, and this person went to a healer, they didn't get the disease. So that it is something that can contribute to people not seeking care when they really need to. So I say that 1 in 5 develop rabies, but it also depends where you're bitten. If you're bitten on the head or the neck and you have severe wounds, so for example, Marco to the right-hand side was bitten on the face here, in the absence of vaccination, your chances of developing rabies are actually closer to 40%. We also found that if the wound is not washed, or the washing of the wound, even if post-exposure prophylaxis is not given, washing of the wound can reduce the odds of developing rabies by 5-fold. So that in itself is a really crucial intervention that is needed. Fortunately, the post-exposure vaccination, when it is given, is extremely effective, which is absolutely great, but it does need to be delivered promptly, typically, ideally within 24 hours. and the whole course needs to be completed. We found that some people, like I mentioned, presented late or didn't complete the course. And in those instances, we didn't see many deaths, but there were some. So the efficacy of the vaccine was reduced. And I want to just briefly tell Mohandos' story. So I interviewed Mohando quite early on in my PhD, and his story really stuck with me. So you can see the bite marks on Mohandos' shoulder. I visited him about a month after he was bitten. They were obviously quite deep wounds. They were actually bite marks from his daughter, Mariam, who was 7 years old, and she died of rabies. So there was nothing that could be done at that point. I mean, for Mariam, Mohando did go and get treatment, but I think his story helps to illustrate just how traumatizing rabies is in a community. And we do actually see about out of human rabies cases, around 10% of human rabies cases expose a family member, putting them at risk of rabies in the same way. So we've learned a lot about the importance of needing good access, ideally free at point of care, to these life-saving vaccines and making sure they can be delivered immediately for the people who need them. And some of this data contributed to a study that we did that was to try and estimate how improving PEP access, post-exposure vaccines, could reduce rabies cases. And we estimate between 2020 and 2035, around 500,000 lives could be saved in the 67 low-income countries that are eligible for GAVI support. So last year, 2019, GAVI, the Vaccine Alliance, actually approved the support for human rabies vaccines in their next vaccine investment strategy. Now, I think things have been quite, things might have changed a bit, but hopefully this vaccine support is still going ahead, even in times of COVID, but there will be some delays. I'm going to move on to surveillance now. So generally, rabies surveillance is extremely poor in countries where there is endemic dog rabies. So you can see here, the graph on the bottom is the cases in Serengeti district, but in red is what I roughly think is the number of rabies cases that would be confirmed and appear as official records in statistics from Tanzania. And you can see they're just the tip of the iceberg. The reason for this is, well, there's many reasons that contribute to it, but there's typically only very few diagnostic laboratories in a country, and getting a sample is not the most pleasant procedure. So here you can see Magoto taking a sample from a rabid dog. The dog was euthanized. You can see already that, I mean, on clinical signs, we would say that's rabies. So you have to take a sample post-mortem from the brain and then safely dispose of the animal. And you can imagine it's not the most pleasant of work. There's not a great deal of incentive for people to do this. And typically, if someone like Magoto is to collect a sample, then it might be several months before he's able to get a report back from the laboratory about whether the animal was rabid or not. So it's just makes things really difficult. And we, of course, want to see improved detection and confirmation, because that makes all the difference between a country's government taking it seriously in terms of control or not. So the fluorescent antibody test is the gold standard for rabies. And there's only one working fluorescent microscope in Tanzania. So that's one of the challenges for diagnosis. One thing that we've been doing quite a lot of over the last 10 years is using these rapid diagnostic tests. They're very similar to the lateral flow tests that have been developed for COVID and are being rolled out in different places now. They cost around $10 per cassette, and they give you a result within around 10 minutes. And we've found that people in the communities, the livestock field officers who are doing surveillance, they find these tests really, really great. It kind of empowers them to be able to get a diagnosis very quickly. There are issues with it. It's not quite as sensitive as the gold standard, so we don't really want it to be driving use of post-exposure prophylaxis. But in terms of just improving case confirmation and getting rabies on the map, we think it's super important. And we know the technology is there to produce these in sort of an accurate and standardized way. I think there's some work that needs to be done in terms of regulatory authorities to be able to produce these at scale and with the right proficiency and sensitivity of these tests. So moving on to the transmission dynamics of rabies. We've understood a bit more about how people get affected by rabies, but we can also measure directly some of the key statistics, some of the key parameters that you've probably been hearing about all the time for COVID, because we can actually see who is getting infected by whom, so the number of secondary cases per primary case, and are able to measure some of the key quantities like the time between a primary infected case and its secondary contacts becoming infectious. So whilst rabies is a really quite simple disease, we haven't had this information really well parameterized, and contact tracing has contributed to improving that. Normally at this point in a talk on rabies, I would spend a bit of time explaining what R is, or the basic reproductive ratio. But I'm guessing that almost everywhere in the world people now know what R is, so I won't try and explain it really, other than to say that when we measure R for rabies, we find it very low. So around 1.2, close to 1, which you should probably know. If we can get R below 1, we'll be heading towards elimination. So this is the frequency distribution of dogs bitten per rabid dog. And you can see that on average, a single rabid dog will bite around just less than actually 2.5 other dogs. And of those dogs that are bitten, if they're not vaccinated, about half of them will go on to develop rabies. So that gives you the quantity R. It gives you the number of secondary cases that result from a primary infection. And on average, that's around 1.2. But I've highlighted in red here that the fact that the biting distribution from rabid dogs is really over-dispersed. So we have this long tail of the distribution, and you have about 8% of dogs that we consider super spreaders that basically contribute greatly to transmission. You can see some really extreme cases here over the period where we've been doing contact tracing. The most extreme dog we observed bit 72 other dogs during the 2 days that it was infectious for. And it's not just the biting behavior directly, it's also the movement of rabid dogs. So on average, a rabid dog will bite another dog less than 1 kilometre from where that dog originates from. And in fact, you can see this big peak here, which is from dogs biting other dogs in their household or in neighbouring households. But again, there is this long tail of the distribution. And here in this tail, you can see some of the dogs like Mome's dog, who I mentioned earlier, that travel over 15 kilometres to bite other animals during their infectious period. And again, we see in terms of the spatial spread of rabies, we see around 9% of rabid dogs are spatial super spreaders. Now, if only we could identify a priori who these super spreaders are, then we would have kind of a magic bullet to get rid of rabies pretty fast. We've looked at the data and tried to pull out what makes a super spreader, and it's actually really difficult. We don't see any particular evidence of the sex of the dog on either its biting or running behavior. We do see that super spreaders tend to be older, or rather we don't see very many young puppies causing this kind of extreme biting and transmission behavior. But in general, it's actually hard to find out about these super spreaders because if you're someone like Momo and your dog has gone crazy, whilst all your neighbours and everyone in the village might point to your dog as being the source, you're generally pretty reluctant to reveal a great deal of information about your dog. So we're still somewhat in the dark about that. But I just wanted to show you a couple of pictures now to kind of emphasize the degree to which rabies can change an animal's behavior. These are provided by Ingela Janssen, who is a lion researcher, and she observed this dog attacking an unsuspecting lion. And you can see from this is not the kind of behavior that we expect from a healthy domestic dog. And the lion itself seemed a bit shocked by it and was eventually chased away by the dog. This lion actually was given post-exposure prophylaxis afterwards and is still alive and doing fine. But it also highlights the risk of transmission to other species and spread in wildlife. I'm not actually going to talk about wildlife transmission in this talk, but I am happy to discuss it at the end if people are interested. So overall, in terms of understanding rabies transmission, we've got some key points. We know that R on the whole for rabies is relatively low, but there's a lot of heterogeneity. So there is super spreading and also sort of in addition to what is largely very localized clustering and spread, we see some long distance movement. At the population level, whilst we've had these two big outbreaks, so you can see here in this animation, these two outbreaks that occur. In this population in the Serengeti of around 60,000 dogs, we really only ever saw at maximum about 1% of the dog population being infected per year. So that means that there are relatively few dogs dying from rabies compared to natural mortality. And unlike diseases like COVID, there is no immunity. Once a dog dies, once a dog has been bitten, it either goes on to develop rabies or it is essentially susceptible again to be re-exposed. So we don't see the herd immunity building up that there is kind of some hypotheses around for COVID right now. What we actually see is the population as a whole remains really susceptible unless there is vaccination coverage. So this movie basically illustrates the contact tracing data that we have. In black, you can see dogs that are incubating the virus, and they turn red when the dogs become infectious. And the links between cases are either ones that we've directly observed from contact tracing, or we infer as being the statistically most likely progenitors to infection. You'll see a few red squares appearing, and those red ones we can't statistically link to any other cases, or at least they seem unlikely. And for the most part, we consider these to be incursions, usually from dog populations around the rest of the district. So this district is surrounded by 6 other districts which all have equally large dog populations and no dog vaccination coverage. So it's very easy for infection to spread. But we can also imagine that, we know of cases where there's also people migrating into the area, and they might be coming with their cattle and their dogs. And if those dogs are incubating the virus, they can also contribute to long distance introductions. Okay, so I'm getting to the most nerdy bit of the talk. I'm not really going into much statistical or dynamical detail, but the kind of interesting thing that we can see from the whole genome sequencing that we've done of rabies cases is that we have, in this particular shot, you can see there's two quite distinct clades that are about 30 years diverged in their evolutionary history, and they are circulating in the same villages on the same landscapes in the same 1 year period. And we think that's possible basically because there is none of this susceptible depletion going on, and that there is occasional long distance movement which can import lineages and allow the disease to circulate in this way. And we think that this actually contributes greatly to the persistence of infection. So this time series illustrates different lineages, not genetic lineages, but lineages that appear to be chains of infection from contact tracing that are like mini outbreaks that underlie these larger outbreaks. And you can see quite a lot of outbreaks that last over several years before going extinct, and potentially new outbreaks being imported from neighboring populations. To sort of switch gears slightly from Serengeti, but show you what this might mean in practice, I want to give you an example from Pemba Island off the coast of Tanzania. And this is work done by my PhD student Kennedy Lushasi and postdoctoral researcher Kirsten Brunker. So Kennedy was contact tracing rabies cases in Pemba since 2010. Now Pemba is it's actually quite a large area, but it's a much smaller domestic dog population, around 4,000 dogs. And since 2010, over the course of his work, he's seen rabies go extinct. And that was because of a dog vaccination program that began in 2011 and was extremely effective. So we were all super happy to see rabies go extinct. And then in 2016, we saw this new outbreak, which was really disappointing. The subsequent sequencing of the virus showed us that those cases in 2016 were unrelated to the lineages that were circulating in the years 2011 to 2014. And actually they were more closely related, and they appeared to be from lineages that were introduced from the Tanzanian mainland. And then if we look back a little bit more historically at the samples that we sequenced from Pemba, we do see that on the island of Pemba, there's actually quite considerable rabies diversity, which we think is the result of introductions that have come to the island from different points across the East African coast. And even in the 2016 outbreak, we saw a second introduction, likely from another part of Tanzania with a different genetic lineage. I can now happily say that rabies has been eliminated again from Pemba Island, and that now the Pemba Island government is a bit more vigilant about maintaining vaccination coverage beyond the time when rabies appears to have been going extinct, and is maintaining vigilance in terms of surveillance. So that takes me really into the last little bit about rabies control programs. So dog vaccination is actually a pretty feasible approach, and it's something that people will really participate in if they have the right information beforehand and are given some warning about dog vaccination campaigns. And using contact tracing data, we're able to say a bit about what the effects of dog vaccinations in Serengeti district have been. So this plot is basically the dog rabies cases over time in Serengeti, together with human rabies exposures and deaths, the red blocks, and dogs vaccinated. So the district livestock office has been involved and has been able to do dog vaccinations almost every year for the past 20 years, but it hasn't been very consistent. And this is due to all the features that make rabies control challenging. There are always other priority diseases for livestock officers who have to deal with foot and mouth outbreaks, rinderpest, and other diseases which are basically prioritized over rabies. And what we observed is that vaccination campaigns were not completed in every village, and sometimes, including at times of handover of staff and so on, there were no campaigns. Instead, what we really focused on since about 2012 is to try and improve the vaccination coverage, and particularly the reach, to make sure that every single village was vaccinated. And you can see a consistent trend in rabies in dogs vaccinated since about 2012. And over that time period, we've seen a consistent decline in rabies. And 2020 has actually been the time with least rabies cases and least deaths as well. There was a gap in 2019 where there wasn't a campaign, which again was really frustrating to us, but it demonstrates the difficulty of trying to sustain what are actually quite cheap interventions, but in a setting with really limited resources and a lot of priorities to manage. So even though we had this gap in 2019, we didn't see a resurgence of rabies, and we attribute that to, during that time, there were very, very few cases circulating on the landscape. So there really wasn't a surge. And we kind of see these same kind of dynamics when you see countries going in and out of lockdown with COVID, actually. We also could directly measure, of the dogs that we traced, which ones were vaccinated or not and went on to develop rabies. And we saw that we visited, counted over 3,000 dogs that were bitten by rabid dogs that had not been previously vaccinated, and 60% of those went on to develop rabies. Whereas of the dogs that we visited that were vaccinated, that were also bitten, around 2,500 of them, only 2% developed rabies. So it's clear that the vaccine actually has been directly preventing cases, and we would have expected at least 1,250 of those dogs in the absence of vaccination to have developed rabies. Okay, so just a few last points to push home this dog vaccination as being a very feasible strategy. People do bring their dogs, often they work quite hard to bring them, not always the way we might recommend them to bring their dogs, but still it's a really good thing that dogs are beginning to be vaccinated. And I have a PhD student, Ahmed Lagello, working with a very large team who are now developing strategies for community vaccination to cover the other 6 districts across the Mara region that also surround Serengeti. And we're really hopeful that this will have a great effect on actually directly eliminating rabies. And I just wanted to show you a couple of the pictures that keep coming in from my phone on WhatsApp of all the good stuff that is going on. So in conclusion, I think the contact tracing has been really insightful to tell us who is affected by rabies and why, and tell a bit more of the human story behind rabies transmission, as well as kind of improving our epidemiological understanding. We've got really important take-home lessons about the need to improve access to life-saving human rabies vaccines, but also about how to deliver mass dog vaccinations and what impact they can have. What is really clear, though, is that rabies really requires a One Health approach. You need veterinary services and ministries of health, both from local level within district livestock offices and with local hospitals, to be working together. Those intersectoral working relationships are really important for all sorts of zoonotic diseases that we might be really concerned about, like avian influenza and so on. And dog rabies control can actually really help build trust in communities, because you do need to reach all the villages where domestic dogs are, and to go in and get samples from rabid animals requires the kind of trust that Magoto built up over many years of working in these communities. So rabies control is cheap, but it also needs a level of investment that we haven't really seen to date from the global community, but we think it's totally possible. And WHO and partners have set 2030 as a target to reach 0 human rabies deaths. So I think people knew some of this information many millennia ago, essentially, the way that dog rabies is transmitted. And some of the stories that I've told you today are kind of reminiscent of stories from some British history books from Victorian ages. And I'm hoping that we can really make these actually history everywhere. So if anyone has any questions, I'm happy to take them now. And just quickly, I should say that this work is actually contributed by many, many people, and I wanted to particularly highlight some of the people here who are very active in this work right now.
Thank you so much, Katie. That was a really nice story. Really comprehensive, and it was really nice to hear about all of this. There are a few questions, so I'm going to read them to you because I think we're the only one to able to see them. So we're going to start with Joseph Agola, who has a few questions. So we're going to start with, how can you do contact tracing for rabid dogs that bite dogs at night?
Yeah, that's a really good question. So we have actually, in fact, one of the categories that seems to show up as what makes a super spreader is any dog that was rabid and was biting at night. Because if a dog is biting at night, it's much harder to track down that dog, and basically it's quite normal practice that people will track down and kill a rabid dog. But if it's active at night, then that's much harder to do. What we found is when we visited people after the event, that often they've heard a lot of commotion at their household. They know something was going on, but in those cases, we're not able to identify exactly which dogs were bitten. But so that is a difficulty. And I think contact tracing in general for rabies is probably a bit more ambiguous in terms of which individual dogs in a household have been bitten. But the amount of, there are people who've been bitten by rabid dogs when they've been going outside to the toilet at night. There are dogs. So most dogs in Tanzania are essentially household guard dogs, and there's often kind of a lot of commotion, and people will report and show to us the wounds that their dog have sustained following an attack at night and things like that.
He's also asking, is there seasonality in terms of rabies cases in the area?
In this part of Tanzania, we don't see any particular seasonality. So nothing like that. There is in some parts of the world, I believe there's a bit more seasonality in dog breeding, and any new puppy is automatically susceptible to the virus until they get vaccinated. So there could be places where seasonal birth rates result in seasonal effects on rabies transmission, but we really don't see any kind of seasonality effect in Tanzania.
He's asking, the new introduction of a different strain in Pemba could be from where in your observation? Any link with wildlife?
So the strains of rabies, the lineages that we detected on Pemba, all appear to be lineages that have been frequently detected in dogs before in other parts of Tanzania. So we don't actually think there is any. We don't really have any reason to believe that there's a particular involvement of wildlife. I will just show you a couple of slides about wildlife transmission though, because it is quite challenging. So these 3 kids were all bitten by wild animals. Boki on the left was bitten by a honey badger, Marco in the middle by a jackal, and the girl on the right has really severe injuries sustained from a rabid hyena. So you can understand why communities are particularly concerned about wildlife and how they might often view wildlife as being the source of transmission. What we found in this part of Tanzania, so this is Serengeti National Park, surrounded by Serengeti to the Serengeti district to the top left and Ngorongoro district to the bottom right, is that we saw a very large overlap between the distribution of dog rabies cases and the distribution of wildlife rabies cases. But when you actually look at the incidence of disease, the blue here is dog rabies cases, and they far outweigh the wildlife cases we see. And the chains of transmission that we observe and we're able to depict from the genetic data generally indicates that in this part of Tanzania, wildlife form at the end of chains. So they're not really, what it seems like is sometimes dogs transmit rabies to, say, jackals or hyenas, and then it will spread for a short period in those other wildlife before going extinct. And when dog vaccinations were carried out around Serengeti National Park, we didn't see any wildlife cases appear in the park for more than a decade. So that's sort of really highlighted to us how important the role of dogs are in terms of transmitting the disease generally and potentially sparking wildlife outbreaks. I do have Kennedy, one of my students, has done a lot of contact tracing in this part of Tanzania in the south, and here he actually saw quite a few more jackal cases than we'd expected based on our experience from northern Tanzania. And in the same way, there was dog vaccination campaigns implemented across this area over a 5-year period. And here we saw this big decline in both jackal and dog rabies cases over several years. And that we attribute to dog vaccination. So whilst jackals are definitely much more involved there, we do think that dogs are driving the transmission, and you see some long chains of transmission that potentially have both dogs and jackals in the mix. But again, once rabies is getting to really low levels, dog vaccination stopped in end of 2016, and we've started to see like quite major reemergence in dogs in one of the districts that borders with Dar es Salaam, which kind of highlights how important dogs are in contributing to driving dynamics across the country. So there is definitely wildlife involvement in some places, but so far it seems like vaccinating dogs will actually prevent rabies in all species, because no other ones seem to really be crucial in maintaining it. Yeah.
It's really interesting because we had a talk on the impact of climate change on African wild dogs a few weeks ago, and she was briefly talking about how the curiosity of African wild dogs when they were going to check on domestic dogs, some were actually making them like catch rabies from those domestic dogs, and when like you would have like vaccinated domestic dogs, it would like actually impact those wild dogs, and they would actually be safe. So it was So our friend from Pakistan is actually asking, may I know if direct rapid immuno test will be a good test to go for surveillance based on laboratory diagnostics?
Yeah, it's funny. I actually, because I was short on time, my slide on surveillance had the fluorescent antibody test and it had the rapid test, and it used to have the DRIT as well, which is what Wakas is referring to, but I just removed it for lack of time. So the DRIT is a really good test. It can be performed with a light microscope. It requires a brain sample the same way, but it can be, it seems really promising in terms of a test that can be used in a much more localized way. It doesn't require this expensive and difficult to maintain fluorescent microscope. We had really good success with it in Tanzania, but it requires really someone quite technically skilled to operate it and to be able to read these tests. And we still also had some difficulty getting hold of reagents. So there are still some kind of practical issues to it, but I would definitely be very supportive of the DRIT being used. And that is, I think that's been shown to be equal to the fluorescent antibody test in terms of the gold standard. I would also say that with the right rapid tests, that's something that is faster and cheaper and can be done more locally, but I would not rely on it. I rely on those rapid tests for post-exposure prophylaxis. If ever there is any doubt that a dog has rabies, someone should be vaccinated no matter what.
He's saying that he's working on rabies and he's trying to develop dog surveillance in Pakistan. He's asking if he could contact you for collaborative help and advice.
Yes, I'll be very happy to do so. I can send my contacts afterwards.
That's cool. So we also have a question from Shalin. Thank you very much for the talk. Are there any differences in transmissibility between rabies, and if there are, do these strains specifically belong to one of the clades you've identified?
We haven't seen any differences in transmissibility. I mean, it's a super difficult thing to measure, actually. But one thing in general about rabies that we've seen is it seems to be dominated by relatively neutral evolution and stochastic processes that seem to underpin the invasion and extinction of rabies lineages. Another colleague of mine, Mohandos, did some really nice work trying to understand the question of transmissibility a little bit more, but in the context of emergence of rabies in new host species. So he looked at these experiments that don't really happen these days, but were quite common in the past, where people would inject the rabies virus from one host species, say from a dog strain, into various bat species and so on, and see how well that animal became infected and how quickly it died. And what we see is basically a bit of a mismatch, so that dogs or viruses that are adapted to their particular host, like the dog virus in dogs or a bat virus in bats, would actually be mismatched in virulence. So if you put a dog rabies virus in a bat, then it develops rabies too quickly and dies before it has the opportunity to pass it on. So there's kind of some interplay, some kind of evolutionary driven interplay between the virulence of the virus and its transmissibility, which seems to affect its emergence in different hosts. But the ones that we've been seeing in Tanzania, they're basically all equivalent to one another. The genetics just allows us to track transmission in a slightly different way.
So I'm thinking about those guys that do the research on African wild dogs. I don't know if you've seen the kind of colors that they use to track those wild dogs. They have these GPS colors that like give them like all kind of informations on those dogs. And I'm thinking that in your research for those super spreaders, that could be maybe saying that like you're like struggling to maybe find like it could be helpful to you to like know. Like it would be like helpful to know in advance. It would be the graph. What make them super spreaders? But I don't know if that will be the solution. But it seems.
Yeah,
like
I think that.
But
yeah, absolutely. I think the issue, well, because relatively out of a really large population of dogs, very few of them are going to actually go on to develop rabies. So we have done some collaring of dogs, of healthy dogs, to see how they move in the past. And there's been quite a lot of other studies that have been done on movements of healthy dogs now. And it actually seems to be relatively consistent that there is, even in healthy dogs, you see dogs that are basically stick around their homes, and then there's some dogs that go on these long excursions. So it does seem to be kind of some characteristic feature of dog behavior that might be exacerbated by rabies. But it's, again, no one, even on tracking healthy dogs, I don't think anyone's really worked out, what whether there's a real driver between dogs that don't move a lot and dogs that do move a lot. It's a curious question.
Okay, thank you so much. That was really interesting. I think that a few people are asking for your email. A lot of people are interested in getting in touch with you. So if you want to share it, share it.
I'll put my email in here. I should warn that I'm not the most efficient to responding to emails. So if I don't immediately respond, get back to me. It's nothing
guys,
personal.
Try your luck. Don't get offended. There you go. Sorry, okay. You share it just with me. So I'm going to share it then with everyone. All panelists and attendees. So guys, I've sent it to you all. Try your luck. And thank you so much, Casey. So usually I post the talks on YouTube, on our YouTube channel. Would that be fine?
Yeah, that's fine.
Okay, so you'll find the talk on YouTube in like a month or so. And that's it. So thank you so much for doing it on a Sunday evening. Really nice of you. And like, thank you. Have a good evening, and I'll be in touch. Okay.
Great, thanks. I hope everyone else has a good evening or whatever time of the world it is with you.
Yeah,
A good rest of your Sunday.
For me, it's very much an evening. Okay, everyone, please, thanks, and like,
Okay.
bye, Casey. Bye.
Great.
Everyone.